Hello everybody, my name is Tony Castrovinci, and I've decided to do a video on the whole Lyme procedure and getting a Picc line. So those of you nervous out there might be able to benefit from this and see the whole experience through. So I'm going to go over the whole process today on what what to expect, what to not expect, maybe some good practices to do, and hopefully you get a little bit out of this video. So first thing I'm going to talk about is how if you're going to get a Picc line in versus going each day and getting poked and having them do it in an infusion center. So I started out, I did each day in the infusion center, and they would take you, bring you in, sit you down in the chair, and you can do it by simple, just like a regular IV gets put in your arm. The benefits of that were, I could kind of see if the medicine was going to, have an effect on my body before I put in the Picc line, or, if I was going to have any kind of reaction or anything like that. So it's definitely, if you're a little leery, maybe you talk to your doctor and see if they can do that first for the first week or so. And, you can get a kind of idea of how your body's going to react. For me, I was very nervous about the Picc line. Obviously, the Picc line has a lot of complications with either blood clots or, infection, or, it could get ripped out. There's a slew of things. But, for me, I wanted to see how it would work with doing blood tests first. So that's what I did. Okay, so in this next part, we're going to talk about, the whole process of doing the Picc line. The Picc line sounds like a very scary procedure. I'll admit I was very nervous myself. You don't know what to expect. You think it's going to, you're going to feel everything, or, they're going to do something wrong, or, maybe not line it up correctly. But I'm here to say that, honestly, the Picc line was very easy to do. The whole procedure, they make it look very, very scary, and it really isn't. A lot of it is when you go into the hospital, they want to do it in a sterile environment. So they bring you into a very sterile room, which has, a bed, a bunch of TVs all over the place. So the whole thing looks very overwhelming. But to be honest with you, you really don't feel anything at all. The only thing you'll feel is, the initial, when they numb you up. So, let's go through the process of what happens with that. So basically, go to the hospital, like anything, they take your blood pressure and some of your vitals. Then they'll bring you back to this room, which has a machine to be able to take pictures, so they know where that Picc line actually goes, for the placement, and make sure it's in the correct spot. Then they will basically lay down this table, make sure the whole room is sterile. They'll get out all their instruments and all that stuff, and then the procedure will begin. And basically, they're going to numb your arm. So if you ever had any kind of stitches or anything, it's just a simple needle where they put some numbing solution in. That is probably the worst part of the whole thing. And it's just a sting for maybe, I don't know, a couple seconds, and then it's over with. It's really, really nothing big. Honestly, that is the only thing you will feel the whole procedure. So once they do that, they wait a couple of minutes. They have you continuously monitored so they can check your heart rate and blood pressure and all that stuff. And then they take out this toolkit, which again looks very scary. They have all these instruments, this guide wire. They have all these different things to do the procedure. They'll measure you out. But you don't, at this point, you don't watch anything. They'll either usually put a sheet over your head or some sort of thing to block out your view of seeing it. So that's the biggest thing I would say, just not to watch it, because if you get queasy, you're gonna, feel nauseous. So definitely don't watch it. But once the numbing is in, they mark the spot. You might feel like a tiny pressure as if somebody's pushing, like this maybe. Again, nothing big. My whole thought was when I first got this started was that, am I gonna feel when that wire is going, going through your veins? Are you going to feel that? It's going to make you feel squirmish. You don't feel anything at all. They literally said, oh, that's it, it's in. And I said, oh, wow, it's in. So it was very quick and easy. And then basically after they, put the tube in the correct position, they'll take a couple of series of pictures with their machine, verify that it's in the correct spot, so you have a little peace of mind that it's not, poking through your heart or out the other side of you. And then that's it. Basically, that PICC line is in, and then they're going to, wrap your arm. They put the first time they put a heavy bandage on. There's not too much blood really at all. Once it's done at all, you really don't see any. So they put this bandage on with this sticky thing, and that's it. Then you make sure your blood pressure is good, and then you can take off and go out the door. All right, so part 3 of this is basically I'm going to show you what it looks like after the, after this has been weeks, obviously, but you'll get the gist of what it looks like in your arm, so you can kind of see. So first of all, they'll give you this sock thing to put over it, kind of protects it. Some people like it, some people don't, but it definitely kind of helps you out. All right, so back to what we were saying here. Basically, you'll see this arm piece here, and you'll have the line that's hanging from your arm here. You can kind of untangle a little bit, and basically the tube goes in right here, and it goes in through the vein. There's a couple veins they can choose, so depending on what they find the best out there, goes through your arm, right in and right into your, right above your, final resting place of the heart there, and then. They'll give you a series of connectors on the end of these, and you got to be very careful. This connector here you need to keep clean. This is, remember, this is a direct line to your heart, so you need to keep this clean at all times, and never ever take off this purple piece here, which is where the the connector is. The cool part about this is where they can draw the blood work as well. So if you're one that gets queasy with the blood work, no big deal, because basically, they pull it in and out very quickly, and everything goes through here, which I will go over the whole process on that as well. So again, not too bad. First couple days, you're a little tiny sore your arm, but nothing, where you're gonna shut your day down. I mean, it's it's more just getting used to. Like if you move around certain positions, you could kind of a little sore, but otherwise, usually after that, not a big deal. One thing to mention I did have with mine, which was sort of a rarity, was when they first put it in, I did have a little bit of heart palpitations. It was very subtle. It was only when I bent over in certain directions, so it really wasn't too bad. I spoke to the doctor, and he had mentioned that this is sort of a normal thing. It does happen. So if it does happen, it does go away. Obviously speak to your doctor and make sure that is not a bigger issue, but it definitely goes away. So that was probably the only thing that I had. And remember, at any point, if something does go wrong, they can always pull it out. They can literally pull it out at the infusion center. It's not a big deal to pull it out. So, if you do panic later on and just don't want it in, whatnot, it can be pulled out very easily. Alright, so this is what it's going to look like. Yours will be similar. You'll definitely get your sodium chloride injections. Flush each line. Then you'll get your thinner here, your alcohol pad, and your elastic ball, which will either be maybe this size or it could be this size here. And each one of them have a clip on the end, which will go into that. Okay, so this part we're going to go over how to clean the line before you're going to do your I call it juicing before you're going to do your your infusions. So this clip here is very important that it stays clean. Okay. So the first thing you want to do is wash your hands, all right? Because anything you pick up, on your hands, and you start touching this, it's, a direct line right in. So you want to clean that, okay? So I've washed my hands. Now the second thing is you're going to want to take your alcohol pad out, okay? And I'm going to open that up. Okay, and you are going to want to clean this out. Okay, so you want to clean it very good. Clean the tip. And again, get inside there a little bit. You really want to clean this. Okay. Now, once it's clean, do not touch the tip. All right, and you're going to want to get a sterile, okay, a sterile sodium chloride injection. Okay, and you know, I don't know the full details, but it's basically, you know, a saline solution in a way. So open it up again. Do not touch the tip. Okay. Sometimes they're a little difficult to open up, but once you get it open up, okay, you want to then remove the cap. Again, make sure your hands are clean. Okay, and there's going to be a little air pocket in here. That is needed. Otherwise, if you don't have this air pocket in here, the syringe cannot move. So once it's in, you're going to want to make sure that that air pocket is up at the top. Obviously, you don't want to shove air into your thing. And you're going to push down hard and turn it. Okay? And then you're going to want to push it in. All right? Some people go fast. Some people do it like this, little pumps. You know, speak to your doctor or nurse on how they want you to do it. Okay? So now that that's in, a lot of times you'll get like a salty taste or some sort of metallic taste. It lasts for maybe a second or two. Not too big of a deal. Obviously, if this is your first time, at this point you want to, you know, keep an eye if you get any rashes or anything like that. And then, you know, you're going to take out your elastic ball. This is what it looks like. It's a pressurized ball. It's kind of rubbery if you squeeze it. All right, it's set to a certain, you know, milliliters and pressure. So usually they come all banded up, so that they're, you know, it's all in one piece there for you. So again, don't touch the tip. All right, undo this. Okay, so that it's open, and then get some of this garbage out of the way here, and then you can sort of spread it out. Right now, here's the tip to this. It just disconnects, okay? And try not to touch either one. All right, I'm gonna put it in and twist. Now at this point, you are hooked up to your elastic ball, okay? So now, after you do that, you have to open up the clip. Otherwise, it will not do anything. If you don't open up this clip, it's not gonna do anything. So you want to open this clip. It just goes like that. And that is it. You are literally juicing, as I say. You're literally, the medicine is coming through. Now, what will happen is, this one, it actually tells you on the tag, usually, you know, it's about, this one is about 30 minutes, okay, once a day. So, on the tag, you know, make sure you read that. Make sure it's your correct medicine, obviously, and that, you know, it's, it'll tell you how much time. So, after about 5 minutes, this ball will start to, like, you'll start to see the plastic around here will crinkle up, sort of. And then after 10, it'll start to shrink, 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 and shrink. And you'll know you were done when this ball was completely shrunken and into the middle piece in there, that middle section there. All right, everyone, we are back. So it's been about a half an hour of time, and I kind of wanted to show you what it looks like after the 30 minutes of time. So the ball, like I said earlier, is going to start to squeeze up. You know you're done. You know, you can squeeze it, you squeeze the air out of it, right? You'll know you're completely done when you push on this, and there is no, it's hard, okay? There's this hard center plastic piece in there, and there's no elastic portion to it anymore. It's hard. It's completely soft, okay? That's when you know you are done. So at this point, you can put aside your elastic ball and find your clip, okay? You're going to want to shut it off again. If you don't shut it off when you pull that, when you pull the end piece off, then it's going to leak all over. So again, try not to touch the tip, okay? Make sure your hands are clean, all right? You're going to unscrew that. Okay, at this point, now you are done with your first medicine. If your doctor prescribed you 2 or 3 or however he did it, you now move on to the next step. So again, do not touch the tip. And we're going to open our second sodium chloride injection, okay? And we are going to run it through the line again. All right, remember that bubble, okay? This is the bubble at the top there. I don't know if you can see that, but okay, you're going to want to make sure that that is up to the top. Okay. All right, put it in, twist. Okay. You don't want to push it through again. At this point, you might get that taste again. Some people do, some people don't. Depends how fast you do it. If you do it slower, I notice it does not get that taste as much. All right, and then we can move on to our second ball. Again, check the label, make sure that it is the proper medication. This one is written that it is 60 minutes. Okay, so this is going to take approximately 60 minutes. All right. Now, one thing I don't know if I talked about earlier is that these have to be kept refrigerated. Okay, so to make it easier on yourself, you want to pull these out, you know, slightly before you start your treatment, so that it's not so cold going in. According to the manufacturer instructions, it's not a big deal if it's cold, but you know, it kind of doesn't feel as good going in when it's cold. So, you know, let it sit out for a little bit, maybe an hour or 2, and just kind of warm that up a little bit. Obviously, do not heat it in any way. That would not be good. Same thing again, unscrew the cap. Okay, put it on, twist, make sure it's on. Okay, make sure you have no kinks in your hose. One thing you'll see is that obviously the flow is limited, so in case this thing malfunctions, you're never going to get more than a certain milliliters per minute. And also on your Picc line itself, it's written on how much it can go in. So this one is 5 milliliters a second is the maximum size. It's an 18 gauge. So depending on what you have put in, you may also have multiple ports. I'm told that might be for if you're doing nutrition or other, you know, things, or maybe 2 at once. But for generally for the Lyme, it seems they only do 1 usually, generally. All right, so we have our ball hooked up. Okay, there's no kinks in the line. Last thing again, remember to undo the clip, otherwise you'll be waiting for nothing. And that's not good. And I usually slide it out of the way because, you know, it's kinked here where the clip is, and I feel like you slide it, it opens it up a little more. So we'll come back after 60 minutes and we will show you how to end this, and that'll be a wrap for the medication portion side. And then I'm going to talk about a couple things that I've noticed, that I've gone through, and maybe some words of inspiration for you, that if you're going through any of this for Lyme treatment. And remember, it also, you know, the Picc line obviously applies to other things. So, you know, even if you're not doing Lyme's treatment, you know, this video should hopefully give you some clarification on, you know, some best practices and stuff, and what it's going to feel like. All right, folks, we are back after 1 hour. This is the second ball that we did. Again, squeeze all the air out of it. Okay, right? And it is hard as a rock. It is done. All right, so you are going to make sure the clip is locked. Okay. We are going to undo it, making sure we don't touch the end. And then we get our remaining sodium chloride here. Okay, we're gonna push this in. Again, being careful not to touch the tip. You do not want to contaminate the tip. Get an infection or something, you'll have big, big problems. Make sure our bubble is up the top. Push it through. Okay. Undo it. Now the last thing we got to do is put our heparin in. Okay. So, you know, typically they give you a smaller size one. Okay. It's just a flush solution. All right. It's the last thing that you are going to do. So it's done the same way. Open it up. Same thing. There's a bubble in this as well. And push her through. And that is it, folks. That would be the 2 elastic balls that we went through. Hopefully this video has helped you in you know, understanding the process of what you're going to go through and what you're going to see every night. Some of the things that you know, I want to touch base on is you know, making sure that, one, you keep the stuff refrigerated. You know, don't leave it out. It's a lot of money to waste if you have to pay out of pocket. A lot of places you have to pay out of pocket. You know, one of the things I really didn't touch base on was why I'm, you know, in this sort of predicament. And mine was stems from Lyme's disease. So I had gotten Lyme's disease, and it was undiagnosed for several years. So one of the ways I was lucky to catch it was through another friend. Actually had mentioned, hey, you have similar symptoms, and you should go see a LLMD, Lyme literate medical doctor, and they sort of specialize in that. Because if you go to the regular doctor, a lot of times they'll give you the regular LabCorp or Quest labs, and when that happens, they're wrong a lot of the times. So that's what happened to me. I had taken that test a few times. It was wrong. And I continued to suffer. I had a lot of balance issues. I had a lot of neurological issues. I couldn't concentrate, couldn't focus. I was, you know, basically almost bedridden. And it just kept getting worse and worse. I went to many, many doctors, and many doctors, you know, first round, oh, well, it's, you know, it's this, or maybe you're just feeling a certain way, or, you know, there was always some excuse. We can't find this. We can't find that. You're perfectly healthy. There's no reason, you know, and it gets very discouraging. You go to doctor to doctor to doctor, and, you know, you tell them, listen, you know, I can barely walk. Oh, well, you know, maybe it's in your head. No, it's not in your head, you know. So just keep at it. Try to make sure you find yourself a Lyme literate doctor that, you know, specializes in that, and, you know, go through the process. Now, obviously, the first process is they're usually typically give you oral medication, and I did that for a long time. I did a lot of different ones. I did Tendamax. I did the amoxicillin, doxycycline, you name it, I did it. And unfortunately for me, it did not work. So this is why we are switched over to the IV, and it's all new to me. I've only been on it for about a month and a half. And, you know, with the IV, there'll be certain days where, you know, you're going to feel a little bit better. And then there's some real bad crash days as far as, I shouldn't say real bad, but there's some, you know, days where you're just going to feel the reaction to, you know, the IV of, they call it Herxing, which I'm sure you're aware of. But, you know, the Herxing can give different people different symptoms. Some people, it, you know, they have a lot of trouble walking. Some people get major headaches, you know, dizzy. I mean, you name it, the symptoms are, they often mimic a lot of other diseases, you know. You know, even lupus, it's very similar symptoms. And, you know, so it can be difficult. But, you know, just keep knowing that, you know, you'll have a couple bad days, and then you should have some good days. A couple bad days to good days, and you'll start to get better and better. You know, and, you know, just keep at it. But definitely don't be scared of the process. You know, if you've been on the oral, honestly, it's really not much of a change other than the excitement of, you know, putting something new into your body and, you know, being worried about it. You know, so far it's been good. You know, if you do see any side effects, definitely talk to your doctor and, you know, work it out with them. Sometimes there's, you know, certain medications that your body just doesn't tolerate, so you can switch it out. Again, that's the great part about the Picc line. It is not permanent. So, you know, it can be pulled out at any time. As long as you keep it clean, you know, typically that's the way to go. And I wasn't able to show you before, but I'm going to give you a little bit better of a view on this, so you can sort of see what we're looking at here, what it looks like. So here's what it looks like. It goes in here, and it's almost like a piercing, like a ear piercing. It sort of kind of heals around it. And when they take this, they do a bandage change each week. And when they do that, you'll see they actually pull it in and out a little bit. You know, kind of goes in and out. There's no blood at all when they pull it in or out. It literally is almost like an earring. It heals, you know, the hole goes around it. And then, you know, you do have to make sure, though, that you do not get it wet in any shape or fashion. If you get the bandage wet, you have to go to the hospital or to the infusion place to get it changed right away. This cannot get wet, because then, you know, the risk of infection. When they change it, you know, I'm going to be honest with you with that. When they change it, it absolutely does not hurt, but you know, it's like, you know, when you get a real sticky, you know, I guess Band-Aid, or, you know, like duct tape on your skin, you go, whoosh, you know, it's like getting a wax. So, you know, after a while you start to get a little chafed up, you know, on your arm, but that's it. I mean, you know, if that's the hardest part about your day, then, you know, you're doing pretty good. So, you know, good luck to you, and, you know, if you guys have any comments or questions, just feel free to leave them in the comments section, and I'll try to get to them. Thank you.